In this country, people often go around saying that we have the best care, but really, while we do have some good, excellent centers of health care, they're only available to those who can afford them or those who live in proximity to them. And that's part of a market-based model of paying for health care. We find that rich people come from abroad to this country to get health care, while our people are struggling and find themselves going to places like Mexico to get surgery, or to Canada, or people that I know who have left the country, gotten sick, and now they can't return because they won't be able to get health care now that they have a pre-existing condition. They're cared for abroad, but they can't come home to their families. We know that in 2009, we had 2.7 million fewer people enrolled in private health insurance, but despite that, the private health insurance corporations had excessive profits, had an increase in their profits during that same period. This is the situation that we're in right now. And what sets us apart from the other industrialized nations is that we use a market-based model of paying for health care, that we don't see health care as a human right, the principles of human rights being universality, equity, and accountability. We have none of those. And we don't have a system. We don't actually have a coordination of our care so that we make decisions on a rational basis of what our population needs. I wanted to comment a little bit about the Deficit Reduction Commission. Have you guys heard of the National Commission for Fiscal Responsibility and Reform? So this new commission of 18 members that was convened in April of this year is looking at ways to reduce our deficit. And one of the ways that they're going about that is looking at cutting our social insurance programs like Medicare, Medicaid, and Social Security. And I just wanted to comment on that because the reality is that health care is a huge drag on our economy. Our health care costs are rising 2.5% faster than our GDP each year. So it's not a sustainable course that we're on. If we actually brought our health care costs in line with what other countries are spending, we would have a budget surplus right now. So health care is certainly a driver of our problems economically, but cutting our social insurance programs is actually going to do more harm than good, because we know that programs like Medicare have reduced poverty, that they bring down health disparities. Our population's health disparities start to decline after they reach the age of 65, and that requiring more people to pay personally for their health care by extending, increasing the age of being able to be eligible for Medicare, things like that, is actually going to cause those people to face the same difficulties that much of our population face of not being able to afford the care that they can get. So Medicare and Medicaid are not the causes of our deficit or our health care cost crisis. They're actually the victims of our health care cost crisis. And so we see this solution, which we've been, PNHP has now been around since 1986 or 87, as a national improved Medicare for all, our national single payer, creating a national universal system, publicly funded so that it's accountable, with a progressive taxation so that it's fair, so that it's lifelong, it's comprehensive, no copays or deductibles, so that when you're sick and you need to go get care, you're not facing any barriers to getting that care. You're not worried about, well, my rent's due this month, so I can't really pay that copay or that deductible for that medication or that test or that visit. It's about creating a system, a rational, publicly accountable, publicly funded system. So what happened during this last process, this health reform process that we had? Very disappointing. At a time in our country when we see such suffering and death and really had a need for an open and honest debate about what we required for health in this nation, we saw instead a very strictly controlled, scripted debate that was heavily influenced by the insurance corporations, spending $1.4 million a day on lobbyists in Washington, D.C. The legislation in the Senate Finance Committee was overseen by a former Vice President of Public Policy of WellPoint, one of the largest insurers in this country. She has now been transferred by the White House to the Department of Health and Human Services to oversee how this legislation is regulated. So it couldn't be any more blatant. And this is what we're up against. And so how are we going to change that? Well, there are three principles that became very clear, and I know that others have discovered these prior to me. I'm not unique, but they fall under the initials ICU. And I think that's apropos because we're in a healthcare crisis and we need intensive care. So the I stands for independence, and that means that we must create a movement that is independent of political party. The C stands for clarity. It's imperative that we understand what it is that we require in this country and that we're very clear about what that is, because what we see instead is so often, this legislation is being called affordable, it's being called guaranteed. It's none of these things. So we have to be clear on what those words mean, and we need to be uncompromising in our demands. Too often in this nation, we're willing to accept small change, and that's what we've been doing now for decades. And none of those small changes, as we try to patch together the health care in this country, none of those changes have moved us forward. And so we have to realize that and stop compromising in being told that this is all we can get and saying that that's acceptable. So I see you. And I just wanted to wrap up with a comment about that movement, because it does need to be a broad-based movement. It does need to link together the various movements for peace and social and economic justice, because it is all related. And too often in this country, we've been divided. We have this whole right-left raging at each other, and the mainstream media, feeds that division. And that's used to weaken us as a people. If you actually talk to people across the board of what their political belief is, we share so many common beliefs. People do believe, that if someone in their family gets sick, that they should get health care. People do, if you take the time to explain it, start to understand the fact that creating a single fund for health care is the most financially efficient way to pay for health care. So there are ways that we can bridge that right-left divide, and it's very important that we do that, and that we come together and join our forces together to work for social and economic justice. And just wanted to close with something that guides me is the principle of nonviolence, because Martin Luther King said that to witness an injustice and to ignore it, to do nothing about it, is committing an act of violence in itself. And so it's imperative that we continue to do this work. As Kathy Kelly, I don't know if you heard her yesterday say so clearly, that the seriousness of the situation compels us to do what we can to make these changes.